Okay, so let us move towards listening to the judges now, because these brand plans were received, they were sent to the judges, and we would love our judges to share with us what they found out in these brand plans and what the future looks like when you have gone through these brand plans. So, first of all, I would like to invite Dr. Mohammad Mujahidul Islam, Director Marketing, Eskayef Bangladesh, to speak on this particular topic. You are invited, Doctor. Kindly share with us.
Good evening to everyone. Am I audible?
Yes, yes, Doctor.
So, first of all, I would like to pay my gratitude and my sincere thanks to Vivek sir. Sir, good to see you after a
Thank
long
you. Thank you
time,
so much. Thank you so much.
and it's a privilege and honor for me to join here in this World Pharma Brand Managers Day, including the Golden Brand Plan Contest. Thank you very much, Dr. Swati, to you as well, and PharmaState for this wonderful initiative. So, though I was actually asked to say a few words, but to me, instead of saying a few words, what I will say that it was a great learning experience for me, and amazing learning experience. I would rather say that hearing from the industry stalwarts. So instead of saying something, I would rather say it was a wonderful, wonderful learning experience. And as a pharmaceutical marketing professional, as I always believe that till my last day, I will continue to learn. So today itself, I think one of the industry stalwart, he has mentioned that this learning is probably like 1 year or 50 years of learning. So it is truly an amazing experience. So it is not only wonderful listening from the industry stalwarts, but also Vivek sir, hearing from two specialist doctors. I think Dr. Sripad and Dr. Neeta. So hearing from them as well, I think that was a wonderful experience. From my side, a small note to the brand managers. I think whatever we have learned from the industry experts, hearing or listening from the specialists or the doctors or our customers, that will give us a totally different perspectives. So that was an amazing experience as well. First of all, I would like to say, as Dr. Swati said, to say a few words regarding all the brand plans that I have personally reviewed. So congratulations to all the winners. But I will say that all the 11 brand plans were really interesting. When I was going through the brand names and the rationality behind choosing the colors and the SWOT analysis and the proposed segmentation planning of each of the brands and the innovative positioning statements and more specifically the creative approach of physical strategies. So I think those were all these were really amazing experience, and all of you have really crafted all the points very well. Especially, I want to mention that a few brand names like Thimola, Mechanoshield, there were some important logics behind setting the brand names, easy to remember by the physicians. Out of the physical strategies, as I mentioned, that I believe that when we are passing the darkest era of our generation, probably the darkest era of this century, and during that particular time, I think these physical strategies can be a game changer for all the particular brands. I want to mention a few strategies. Those were mentioned in the brand plans, like online courses for doctors, social media articles, telemedicines, podcasts from KOL. So there were different interesting ideas. Those were mentioned in all the brand plans. So I think for me, it was also a learning experience, and I wish all the participants who have participated in this brand plan contest, I wish you all the very best in the coming years in your journey forward. Now, next, Dr. Swati, as you have mentioned, to say a few words regarding the future of this pharma marketing. So I just very briefly want to share 3 points here actually. First one is I have not prepared any slides. So after listening from the industry experts, first point I want to highlight is relationship marketing. So I know that while going through the brand plans, I have seen that each of the participants actually they have divided their promotional budget into different promotional aspects, like be it regarding any promotional brochure or any compliments or any CME or sponsoring the doctors to any scientific seminars. But to me, one point I felt that I want to share with the brand managers that how can I make my brand emotionally associated with the doctor? So while I'll be developing my strategies, say like my literature or my CME or my sponsorship plans, how can I help my medical reps so that he or she can get associated, emotionally get associated with the customer? He or she can build the relationship with the customer. I think Dr. Nita, she has mentioned that relationship out of everything, relationship with the customer is very, very important. When Dr. Swati asked that when many companies are visiting a specialist doctor for the same generic, then how will you remember one particular brand? So I think relationship is very, very important. I don't want to go into the details of how can a brand manager, but just to give you an example from my brand perspective, how can I build a relationship with the doctor, or maybe with the mother of the doctor, or the children of the doctors, or the spouse of the doctors? For example, I'm the brand manager for a hormone brand, and I have my list of customers. So out of my list of customers, for example, if I know how many of my targeted doctors are suffering from hypertension or suffering from diabetes, I'm a brand manager for a hormone product. So maybe I can develop a strategy based on which strategy I can support my hypertensive customers, whatever they need, be it in terms of their any personal requirement or any knowledge-based requirement. If my brand can get associated with one of that doctor's personal requirement, that will help my medical rep to build a relationship with the customer. So that is the first point I want to highlight to the brand managers. So let us focus on relationship marketing while developing my strategies or while allocating my promotional budget. The next point I want to highlight is ethical marketing. I think while I was listening to Mr. Bhabesh, probably he mentioned about Lentus. It was Vivek sir. Once again, I want to mention that it was a wonderful experience listening some brand. When they were reminiscing some brands like Esilock, Revital, and Lentus. So I think Mr. Bhabesh, when he was mentioning about his brand, he mentioned about right science. So my second point to all the youngsters, the future leaders of the industry, will be the ethical marketing. So when you will be building your strategies, or when you will be preparing your concepts, like one doctor, Dr. Sripad, he mentioned that it is the science, it is the concept selling that is most important. So once you will be building your concepts, your strategies, please always remember about ethical marketing, the right science, Mr. Babesh mentioned. So maybe sometimes in my entire marketing career, I have noticed that there are sometimes I have noticed some confusing statements. Like while I am highlighting the efficacy of my particular product, sometimes I have seen some confusing statements. Every company is highlighting about the quality. So while I'm highlighting about the quality of my product, please don't overclaim. Please don't make any confusing statement. So that might create, please don't make any confusing positioning statement. So that, my any single confusion, which might create a confusion in the doctor's mind. So what I'm trying to say that any negative impression, if comes into the mind of the doctor, when my brand's name is there, that will create a permanent damage to my brand. So my first point was relationship marketing. How can I, get my brand associated with the relation, so that my medical rep can develop a relationship with the customers. My second point is right science, ethical marketing. Please focus there. one single mistake, if my doctor gets confused regarding any of my statement, any of my positioning, any of my overclaim, that is actually permanently damaging for my brand. And my last point for tonight's, this wonderful opportunity will be to all the future leaders of this industry: put your personal signature to the industry, put your fingerprint to the industry, so that once you will look back your look back to your career, maybe after 15 years or after 20 years or after 30 years, what our industry stalwarts are sharing today, they have a huge experience. So put your personal signature. What I'm trying to say, in your entire career, launch some of the brands. Whoever is your supervisor today or your mentor, request them, launch some of the brands, at least one brand in your entire career, or two brands or three brands. That maybe for the first time in the industry, or that creates some vibration in the industry, so that once you look back after 25 years or 30 years, you can that will give you a huge feeling that I launched this brand. It is my creation. It is my baby. Today, this brand in the Indian or in Bangladesh pharma industry is one of the top brands. That will give you a wonderful feeling as a marketer. Like every industry stalwart shared about their different brands. So I will conclude by sharing one of the brands from SKF. So as I mentioned, that when we are passing the darkest era of the century, in the first week of May, in my entire marketing career, when a news was highlighted in Bangladeshi media that one company, SKF, where I am serving actually today, I am blessed to be a part of this wonderful organization. When this organization announced that SKF has successfully manufactured remdesivir as the first generic remdesivir brand in the world, just 1 week after when it was announced by the FDA as the approved treatment for COVID. Can you imagine being a Bangladeshi company, or the brand manager who has launched this very particular brand, remdesivir? Our SKF's brand is Remivir. Throughout his career, throughout his life, this Remivir will give him a huge, sense of motivation, sense of, uh, so it will sense of encouragement I believe give him a confidence to go through his career. So that was my last point, that put your personal signature.
Cheers for that, and I wish this brand all the best.
Thank you, sir. So with this note, once again, by giving thanks to all of you, I want to conclude. Thank you very much.
Thank you, Dr. Mohammed, for the wonderful words of wisdom. 3 points that all the product managers should note down in their notebook and reread it twice a day.
You're prescribing like a doctor.
Thank you, Dr. Islam, for sharing these insights. I hope the industry follows suit.